Thank you, Madam Chair. It seems to me that the trust between a provider and a patient is at the heart of quality family planning, and I'm particularly disturbed by the alarm raised by numerous medical associations and in the testimony today about the devastating impacts the new Title X rule could have on this relationship if allowed to be implemented. So as providers yourself, I'll go back to Dr. Parrott and Dr. McLemore. I wanted to ask, I'll start with Dr. Parrott, why is trust essential to the patient and provider relationship, and what role does trust play in supporting that patient's family planning and health needs? I know you talked a little bit, but if you would elaborate.
Absolutely. I could not imagine showing up to see my provider and have their hands tied regarding the type of counseling for any medical procedure or any complication or any condition, anything that I show up for. So this baseline level of trust means that when a patient shows up to my office, then I can have an honest conversation. They don't have to be concerned that my motive is anything different or distracting from what their ultimate desire is. As a physician, my priority is always my patient. This conversation around promoting abortion in one way or another, the only thing that I promote and prioritize is the health care of the community I serve, period.
And Dr. McLemore, would you agree, or do you have anything to add? I mean, I think if I understand what she's saying, is that, even what my previous colleagues said is true, that you can't even mention or even give information about abortion, that in itself is harmful to the patient-provider relationship, that you have to limit what you say in any way.
I do. I mean, if that's what patients want, that's the whole essence of patient-centeredness, is to be able to ascertain and create a situation where patients can tell us what they need, and as service providers, we can provide them what they need. I do want to point out that the patient-provider relationship is inherently one of unequal power, and we hold that power and the relationships that we have, with patients. We have information that the public needs. And so if we can't give them the full range of the information that they have to make the choices and decisions that they need to make, I think it really puts us in a bind with potentially catastrophic consequences.
All right, well, I agree. Dr. Foley's testimony stated that the new rule, and I quote, places a high priority on preserving the provider-client relationship. Ms. Coleman, based on your familiarity with both the new rule and Title X providers across the country, do you agree with Dr. Foley's and HHS's contention that the new rule places a priority on preserving the provider-patient relationship, and why or why not?
Mr. Pallone, I would start with the fact that under this rule, the Title X program, which exists to help women achieve or prevent pregnancy, would not require pregnancy counseling at all. The rule would allow it, but not require it. In the National Family Planning Program, meant by Congress to help people prevent or achieve pregnancy. This rule drops out the requirement that you discuss medically approved contraception that are both acceptable and effective to clients. And this rule says that if a patient asked you for a contraceptive method that the provider disagreed with or did not support offering, the provider does not need to mention, the entire entity does not need to include certain types of contraception that the entity or an individual provider finds objectionable. So for all of those reasons, of course this rule steps into the relationship between a patient and a provider.
See, one of my concerns, and I don't know if I can articulate this, is that this is going to allow so-called providers who don't believe in contraception, who don't believe in abortion, who don't believe in any of the above, to still get Title X funds.
Well, they don't get them now.
No, but they would under the new rule.
They will.
So you could actually make, I mean, the way I read this thing, I could go there and say, look, the only thing I do is preach abstinence, right? And I want Title X money. They would probably they would be approved.
Certainly, a service side could do that. It also, the rule itself says a couple of times that entities should be allowed to apply conscience in deciding what the service mix is, and the rule also says that the referral requirements in place now deter qualified providers from participating.
It's just
So it
scary.
seems very clear the rule was written to open the door to ideological providers and completely walks away from our commitment to be client-centered in family planning care.
It's such a scary thing to me that, ideology, it's already a problem, but if it gets to that point, it's even, a worse situation. Thank you. Thank you, Madam Chair.
Thank you.